Here are my top 10 tips if you are about to have cataract surgery. Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist and cataract surgeon. I recently did a video about what I would do if I were to have surgery, and that got me thinking that I should make a video about some of the tips that I would give my friends or family or my patients who are about to have cataract surgery. So let's get right into it. If you're thinking about having cataract surgery, the first tip I have is to make sure you are adequately addressing any surface issues such as dry eye. Most of my patients have some degree of dry eye. If you do have dry eye, it is really in your best interest to treat this. I actually made a video with Dr. Eye Guy, which I'll link down below, where we discuss why dry eye and cataract surgery kind of go hand in hand, tips that we have, as well as why it is extremely important to address dry eye ahead of time. If you are interested, you should definitely check out that video. The take-home points are that dry eye and cataract surgery have a lot of overlapping symptoms like blurry vision and glare. There is overlap in the age distribution between cataracts and dry eye. And treating dry eye and getting on top of your symptoms before surgery is important because it directly affects our results and the measurements of the lens that we put in your eye, as well as how severe your symptoms will be to you after surgery. I highly recommend, at the bare minimum, you get a high quality preservative-free artificial tear that you can buy over the counter and put that in your eye consistently. And if needed, talk to your doctor about potential prescription treatments that you may want to start before your cataract surgery. Don't go into your cataract surgery consultation unprepared. Your surgeon will talk to you about everything that you need to know about the surgery, including the risks, the benefits. They may have some recommendations about what you should consider for your surgery. Usually during the consultation, we'll ask you to make a preliminary decision right then and there in the chair. It is in your best interest to do some research ahead of time. At the very least, you should think about what your refractive goals are, how you would like to spend your time without glasses, in case that is achievable, and in case your provider can give you some recommendations to make that happen. I did make several videos about the types of lenses that we are offering for surgery, including an updated one, which you can definitely check out as a way to prepare for your cataract surgery consultation. And you can always ask the clinic ahead of time so you can get an estimate on pricing and the types of lenses and procedures that your surgeon offers. Do come prepared to take notes and ask questions about your eyes and the cataract surgery. While I can give you a basic idea of what to expect during surgery, every surgery center and every surgeon is a little bit different. Ask questions regarding your surgery, the logistics, what your anesthesia would be like, what kind of drops you'll need after surgery, as well as anything you should expect before, during, or after your surgery. Don't ignore the advice of your eye care provider. If your provider tells you that they would highly recommend a type of lens, or they would highly not recommend a type of lens, if you trust your provider, definitely listen to their advice. Most of these providers have done a lot of surgery and have seen results from many of the lenses that you're considering. So if they feel that you are not a good candidate for a specific type of lens, or if they feel that you would really do well with a certain lens, I would definitely take that into consideration when you are making your lens choice. If you feel uncomfortable with the choices that you've made with your eye care provider, definitely voice those concerns. And if you feel uncomfortable with your provider, you can always seek a second opinion if that's available to you. During this surgery, please do tell your provider if you're having any pain. Eye surgery should be mostly comfortable. It is normal to feel hands resting on your cheek, as well as some pressure throughout the surgery, but it is not normal to have severe eye pain or an uncomfortable sensation. If you are feeling anything, please let your provider know immediately so that they can give you some more sedation or more pain medications so that you can be comfortable for the rest of your surgery. Being uncomfortable during surgery does a disservice to both yourself as the patient as well as the surgery team, because when you are uncomfortable, you tend to kind of move your eye a lot, squeeze your eye more, and that can cause a lot of disturbances during the surgery and make it very difficult for the surgeon. If you happen to be awake and aware during surgery, your job is to keep your eye as still as possible. One reason why we don't completely knock you out during cataract surgery is that so you have some awareness of where your eye is looking. And you should always try to aim at the middle of the microscope lights. For most microscopes, you'll see 2 or 3 lights up above. You want to try to focus right in the middle of those lights. If your provider asks you to move your eye in a certain direction, follow those instructions and do your best. After surgery, do call your provider if you have any sudden symptoms such as flashing lights and floaters, sudden eye pain, or sudden loss of vision. While we do expect that immediately after surgery you'll have some floaters, some blurry vision, and maybe a little discomfort, if you have anything that's getting worse and not better, that's typically not expected. And if you're not sure, you can always call your clinic or your eye doctor. Most surgeons will have a doctor on call that you can talk to about your symptoms. If it does sound concerning, we usually want to address these right away. Make sure you follow your instructions. Don't bend over, lift heavy weights, or go swimming. There are reasons why we have these restrictions. When we bend over or lift heavy weights, that can cause a lot of pressure behind the eye, which can result in complications like wound leakage or lens displacement. We also want to avoid swimming or excessively moist environments, since there are a lot of atypical bacteria, parasites, and fungi that live in our water sources. And you just want to be very careful overall not to bump or rub your eyes for the first few days. Make sure you do your eye drops as prescribed. These drops are important for healing. After surgery, your body will produce a lot of inflammation inside your eye. These anti-inflammatory drops will counter some of that inflammation to minimize scarring as well as quicken your healing time. Last but not least, don't expect perfection. While cataract surgery can and should be an amazing experience, the purpose of cataract surgery is to replace a cloudy lens that has developed inside your eye. Even with the best lenses that we have in the market, we can't replicate your 20-year-old eyes. What we can do is work with your refractive goals and your budget to provide the best possible primary outcome of having better vision with glasses or contact lenses. Any refractive outcome that we are trying to achieve is a secondary goal of cataract surgery. Make sure you discuss any expectations that you have about surgery with your provider. Just because your neighbor had 20/20 vision the day after surgery and does not need reading glasses does not mean that you will have the same outcome even if you get the same exact lens with the same exact surgeon. So in summary, make sure you come prepared before your surgery, you follow instructions during your surgery, and you stay vigilant and try your best to have realistic expectations after surgery. I hope this was helpful. Let me know in the comments below if you have any questions. Thanks for watching, and I'll see you in my next video.